Thank you for joining us for our presentation of a Wabanaki vision of recovery, the journey to building culturally supportive substance use disorder treatment and a continuum of care. My name is Erica Farnloff, and I am the Division Manager for Recovery Housing and Supports at Wabanaki Public Health and Wellness. I'm very excited to be able to welcome our panel today. We have Chief Clarissa Sabatis of the Holton Band of Maliseet Indians, Chief Kirk Francis from the Penobscot Nation, and Lisa Sakabason, Director, Wabanaki Public Health. Today, we are going to be sharing the story and the journey of the Wabanaki Center for Healing and Recovery. And I would like to introduce our first speaker, Chief Clarissa Sabatis. Chief Sabatis is the chief of the Maliseet Indians. She is from Holton, Maine, and a registered nurse. Prior to her current elected position, she spent many years helping to lead a team to establish the public health infrastructure for the Wabanaki tribes of Maine. Chief Sabatis is passionate about the health and well-being of her people and focuses on improving conditions that impact the overall health and wellness of the Maliseet Nation. Chief Sabatis is committed to the Maliseet language and cultural efforts, spending much of her time promoting culture, language, and healing. She is a leader in the current efforts to improve state-tribal relations and to recognize tribal sovereignty. Thank you for joining us, Chief Sabatis. We are excited to hear your words.
Greetings. First, I'd like to say thank you for the opportunity to join you today and talk a little bit about the Wabanaki tribes and the Holton Band of Maliseet Indians. This opioid epidemic knows no boundaries, and that's true for us in Wabanaki territory as well. Prior to my tenure as chief, I worked in public health and spent many days and hours convening tribal leadership and tribal citizens and partners, including the federal government, to talk about how we can address this disease and how we can, heal our people, I guess. As chief, my decisions that I make now impact, my small community and my small tribe. However, we also have to live with the impacts of decisions made external to us, and those can be good and bad. While there's been some wonderful work taking place within our communities and at the state level and federal level with regards to prescription drug misuse and illicit drug use, I think the piece that's missing or has been missing is how do we replace those things and give our people healthy alternatives? How do we treat them with no resources? We live in an area where it's extremely difficult to access detox. We live in an area where, we end up having to send our people to North Carolina or New York to get residential treatment. And, so there's a lot lacking and a lot of needs that are unmet. And as small communities, while I would love to be able to say that we can meet every single need for our people, we just don't have the capacity, and we rely on outside resources to help meet those needs. And when we don't have the available resources, it makes it hard to come up with solutions to help our people be healthier. I feel so fortunate to be here today with you and share that because of the hard work of Wabanaki Public Health and Wellness, tribal leaders, and our partners, that all of our dreams and our visions are coming to fruition. And with the creation of the Center for Wabanaki Healing and Recovery, that we're really going to be able to provide services to our people in a way that really envelops them as an individual, and not just treating their physical needs, but also their spiritual and cultural needs as Wabanaki people. I'm sure Lisa will go into more detail, but I wanted to talk about some of the conversations that took place throughout this process and just highlight a few things that people said were really important. And I think that, this was pretty consistent across the board. I guess to start, the consensus was that we didn't want any place where anyone was healing to feel like an institution. We wanted them to feel at home. We wanted them to have the familiar smells of home, whether it was our grandmother's cooking or, our sacred medicines burning. We wanted to have familiar sounds. We want to make sure that our Wabanaki drums and music and songs are playing, and we want to see familiar things from home. Artwork from our people, whether it's baskets or drums or clothing. Those were a lot of the things that were important. And access to our sacred medicines, access to our sacred spaces, and in an intentional way. So not having sacred fires as something off to the side, but really integrating our cultural beliefs and our healing practices into this Western medicine that is happening. So we're not just addressing the physical needs of our people, but their needs as a whole individual and as a Wabanaki individual. So, what we do know is that our culture is a protective factor, or feeling a sense of belonging. And we really wanted to have that be front and center through everything that we do. This work that's taking place is a foundation for our communities to continue to heal. It's my hope that my community and my tribe, and even beyond our borders, will see a day when we live free from addiction. So I will leave you with that, and thank you again for the opportunity to join you today. Maliwan.
Thank you, Chief Sabatis, for your words, your vision, and your support on this ongoing journey. Our next speaker is Chief Kirk Francis of the Penobscot Indian Nation. Chief Francis has served as chief since 2006 and holds the distinction of being the longest-serving chief of the Penobscot Nation. He currently serves as the president of the United Southern and Eastern Tribes and formerly served as the treasurer for USET as well. In addition to serving in leadership to his tribal nation, he also chairs the Natural Resource Committee of the National Congress of American Indians. Chief Francis has deep cultural ties to the people, the land, and the river. He is an avid outdoorsman, practicing the traditions of hunting and fishing, for which his family is well known. Thank you, Chief Francis.
Good afternoon. My name is Kirk Francis, and I'm the current chief at Penobscot Indian Nation, and it's great to be talking today about the opioid crisis that's facing not only this entire nation, but obviously in a disparaging kind of way in our tribal communities as well. Just early on in my time, I've been the chief now for 15 years. This has been an issue that's been with me from the beginning. In 2005, 2006, we were really battling addiction through prescription drug abuse. That was really the crux of our issue. And what we realized very early on was that obviously this is a multifaceted issue that requires a very comprehensive approach in terms of treatment. There are many driving factors. There are so many triggers in terms of where people are economically, where people are with their housing insecurity, food insecurities, a whole host of things that really drive a person's addiction. It's not simply about getting people to stop doing them. There's a whole list of other factors around that. And the other thing we really realized early on, from 2006 through about 2012 or 13, was that nobody was really coming to save us on this issue. In the Northeast, there was a huge prescription drug problem. In out west and in other places, tribes were really starting to deal with the methamphetamine problem at that point. And all of the federal resources, everything from jails to methamphetamine based programs were being funded. And despite our efforts every year during the appropriations process to really get focus on what was happening in terms of prescription drug abuse, kind of fell on deaf ears during that period of time. And then, of course, this issue caught up to everyone across the country. And then, of course, methamphetamines caught up to us here a little bit. So we were very active in this area early on. And then what we start to see later on is really the switch from a pill that may cost somebody $100 on the street to a much more cost-effective way for the addicts to abuse these drugs through the kind of prevalence of heroin at that point, and then of course a whole host of fentanyl and a whole host of other things that start to come into play over those years. So our community starts to get more and more kind of devastated by the effects of this addiction, because it's more readily available, and it's cheaper, and it's also much more dangerous, as we know, and we start to lose people. And with the creation of Narcan, of course, those losses could have been a lot more in our communities, but we're able to mitigate some of those losses with the administration of Narcan within the community. So all through that period of time, some of the lessons learned were that despite our best efforts through wellness courts, through our great programs, through all of those things, we needed a wraparound approach. And a huge part of that wraparound approach is being able to get people into treatment. And tribal people are different than other demographics of people in the sense that, getting people, one, to admit they have a problem, and two, to want to go to treatment. But there are a lot of things that are kind of inhibitors in that process, in terms of leaving the reservation, going to a place where there might not be any cultural programs, there might not be any tribal understanding, all of those things. And I personally had people at my desk one day seeking treatment and not be able to find them 6 or 7 days later, because we're going through some bureaucratic process that in other facilities that I guess fairly are also stressed with numbers and how many people they can take in and all of those things. And you lose people in that period of time. It's important to get those folks into treatment in that moment and be able to get them the help they need, because any excuse to go back to the drug use, and it doesn't take long, you've kind of lost them. So what we started to really think about, and quite frankly, it's a daunting task to try to figure out how do we get our own treatment-based facility here in Maine that focuses on Native people, that allows them to be talked to in a way that they understand culturally, all of those things. And of course, we stumbled around that issue for a very long time. And of course, the partnership with Wabanaki Public Health and Wellness and others to bring this conversation to a new level was really invigorating, I think, in the process of really being able to realistically think for the first time that we could get these things accomplished. So we knew the missing piece was getting people to treatment where they could be cared for, where they could also be understood, and also ultimately have successes with that. So this kind of dream we've had of a treatment facility is now becoming a reality. When we talk to all the other tribal leaders and the meetings we've held now for years to try to flush this out, it just, the more and more we met, the more and more we continue to talk, the more and more that, people like Lisa and folks at Wabanaki Public Health and others were really starting to show us that there's a reality that can happen here. And now it's, of course, a very exciting time in terms of where we are in this process, to have facilities that we know are dedicated. You can see them. It's very tangible. And you also understand what the program's going to look like, how people are going to be treated, where they're going to be treated, what's available for them, and then a targeted date of an opening that is in the very near future that is just super exciting. So we've kind of come full circle on this issue from really kind of spinning our wheels for a long time to try to figure out the comprehensive kind of wraparound approach to deal with people, understanding where those gaps were, and then being able to say, we need partnerships and we need people that are going to share that vision and focus on this issue. And that's happened. And I, for one, am really appreciative of it. I am touched by this disease like everyone else in tribal communities. I have family members that continue to struggle with it today. I've lost family members. And so it's not unlike a story that most tribal people can tell you. And so I just think it's extremely personal for me, because it's been, quite frankly, a feeling of failure around this issue for a long time. And so whether we're talking about helping people through educational outcomes, economic success, housing security, and just overall sense of worth, that's the real challenge, and really what we're trying to do and accomplish, because we want people to feel uplifted. We want people to feel like they're part of the productive process in the community. And quite frankly, when people are lost in this addiction, it's really difficult to make them feel that way, especially when so many people around them are hurting because of their behavior and other things. So I think it's not only a great way to get people treated, it's a great way to give people their lives back in terms of getting them reintegrated in the community. So on behalf of our tribe, we're just super excited about this thing coming to fruition, and being able to see it myself last month and really walk through those properties. You can really see the vision there and how people are going to benefit.
Thank you so much, Chief Francis, for your words and your emotion and everything. So thank you so much. I'd like to introduce our next speaker. It's Ms. Lisa Sockerbasin from Wabanaki Public Health and Wellness. She is our director. As a Passamaquoddy citizen, Lisa has an extensive experience and expertise in tribal and state government, nonprofit management, and philanthropy. Prior to Wabanaki Public Health as an organization's director, Lisa served as the director of the Office of Health Equity, Maine Department of Health and Human Services for 10 years, and before being named the director, Lisa worked as an epidemiologist in the infectious disease program for the state of Maine. Early in her career, Lisa worked as a nurse epidemiologist with the North American Indian Center of Boston, focusing on health disparities and inequities facing the Native American communities in Massachusetts. And with that, I will turn over the presentation to Lisa. Thank you so much.
Thank you, Erica, and thank you, Chief Francis, as well as Chief Sabatis. I'm going to start sharing my screen. I have a presentation. Chief Francis was able to share how great it was to see the vision of the work. And I would love to share with all of you that same vision. So what we wanted to make sure from the very beginning with our work, and I think you've heard it in hearing from tribal leadership, is that wherever you are in your journey, we want to have a place for you. We wanted to be sure that whatever we created for recovery services for our people, that there was a place regardless of where you were on that journey, whether you were in active addiction, you are currently using substances, or perhaps you are just being released from being incarcerated and haven't used substances for a while, but need a program. We have a place for you. If you needed medication-assisted treatment, we have a place for you. If you needed assistance with a job after leaving a recovery home, we wanted to be able to serve you there as well. We wanted to serve you if you were in crisis, and we wanted to serve you when you were well. So the areas that we knew we needed to focus on was first food, and making sure that we are able to serve our folks, that they're able to be nourished both spiritually and physically. Obviously, recovery services, which we will be talking about. Crisis services. One of the things we knew we needed was to be able to know when people were in crisis in the moment. And as Chief Francis stated, that there was a place for them to go after we were able to address the crisis in the moment. We also knew from the very beginning that our communities needed to be ready to welcome people back when they were ready to go back, and that there needed to be services in our communities as well. Peer services is something that we have really focused on growing and supporting. We believe that peers and people that have similar journeys of substance use disorder are sometimes the strongest advocates and supports for those folks that are currently in a different place in their journey. And then, of course, community response. How are we responding in our communities and setting our communities up for success in this work? So these are our places. These are the places that we took our tribal leaders to visit. We have a gathering place. We have a place of culture, healing, and ceremonial connections. We also have a family and friends connection center, a healing lodge where many of the services will be provided, your traditional services of case management, group therapy, and also in partial hospitalization services. That will happen at the Healing Lodge. And then we also need places for people to reside. So we have recovery homes as well. Each one of these places are at different stages of development. We know that we will be able to open at the end of summer, early fall. But opening may be just opening our gathering place as well as our Healing Lodge and recovery homes. Our Friends and Family Connection Center will come later. So first, our gathering place. Our gathering place is situated right alongside the Penobscot River. It is sacred Penobscot territory, and we are fortunate to be able to have a piece of this amazing property. It's 45 acres. They have wooded campsites that we are renovating, as well as much space that could be utilized for both office space for our growing staff, as well as services that we're excited to be able to provide. What we know is that creating connections to the natural ways that we heal is something that, first, is very inexpensive, and second, very effective. And so these ways that we heal and connecting to our natural environment, being out on this property in our canoes and kayaks and incorporating our language, connecting to anything cultural is an opportunity for healing. And this is a beautiful property that will allow us to do that. One of the things that I mentioned before was our connection to food, our need for nutrition, our need to be healthy. And so our Denoxin program, or our abundance program, is situated here on this farm, where we have raised beds as well as a 70-foot greenhouse and other gardens that not only will serve as an opportunity for people who are in recovery to heal through service and growing and watching other things grow, but also be able to eat and be nourished by this food. And this food will be not only delivered to the people within recovery, but to all of our communities. Being able to be connected to our traditional foods is something that is incredibly healing for people with substance use disorder and those of us who do not have substance use disorder. This healing is possible through food and celebration in our culture. And this gathering place is just the perfect place to be the home of this work. These are pictures of interns, our student interns, people who work in our areas of recovery, building the greenhouse. This greenhouse is now complete, I will say, and we're really excited to be welcoming every tribal chief and council to this property and be able to see the property now, which these pictures are just a few weeks old, but it certainly has been transformed. Our Family and Friends Connection Center, the building is down on the bottom that you can see. One of the things that we learned from traveling across the country that was critically important is connection to family during the time of receiving recovery services. So if somebody is in recovery services and needs to be away from their home community, that we have a place for their family to come to. When it is therapeutic in their recovery, that there is a place that their family can come to because there's a place for them. And not only is there a place for them, there's food for them because we have gardens on all of our properties. And not only that, we are looking at opportunities for childcare. We so desperately want to develop childcare, not just for our folks that may have family in recovery services, but all the folks in this town of Millinocket where we know childcare services are needed. Our Family and Friends Connection Center is something we're deeply committed to, but this project costs money, more money than the others. And so this project is definitely in our 2-year plan, but will not be opening this fall unless the resources come through. Our Healing Lodge. This property is where most of our services will be delivered. Your traditional recovery services that are offered at many places of recovery will be offered here. Again, this property is being transformed and looks very different than what you see here. And this is in the middle of the renovations. I will say, again, this looks different. What we wanted was wide open spaces. We wanted healing to be wherever people were. And if you needed to be inside, we wanted you to find healing inside as well. And what heals us, we want to bring with us. So we know that 45-acre property that is part of the Wabanaki Healing and Recovery Campus is just down the road, but where you receive services can be healing as well. So welcoming those elements of nature and still allowing the openness of the space, but also the privacy that's often needed when group or individual treatment, conversations, or therapy is occurring. We need a recovery home near these services. We cannot have treatment services away from our communities and not offer a place for people to live and stay while they're accessing services. So we recently purchased this building, this white building that you see. This will be transformed into a men's recovery home. Men will be living in this home residing in this home and have the ability to seek services right beside this home. So our Healing Lodge shares a driveway and parking lot, and their properties abut. So it is now one big property where we have the recovery home as well as the services provided right in the same area. Now, this is a recovery home for men. So we've built relationships with a local recovery home for women in Millinocket. Breaking the Cycle is an excellent, beautiful recovery home that serves women from across the state who need these services. We also have a partnership, and we work very closely with Breaking the Cycle to work with our Indigenous women. And we work very closely to make sure that this home is comfortable for all women, including our Indigenous women. This home, again, is not far from our Healing Lodge where services are provided. So we have a place for our women to be when they're accessing services just down the street. Our recovery home in Bangor is a home where we want to welcome people after they've received services, perhaps in Millinocket, or whenever they're ready for this level of recovery home. This recovery home is a recovery home that's located in Bangor. It services Indigenous men, and we have Indigenous men living in this home right now. It is an amazing program. We connect the men in this program not just to recovery services and support their recovery, but connect them to employment services, making sure that whatever their goals are goals that we can stand behind them in accomplishing and helping them every step along the way. That continuum of care was mentioned earlier, that continuum of care of providing crisis support services and a crisis care line was something that we knew we needed to do. That again, going back to, we have a place for you, no matter where you are in your journey, there is a stop. There is a place where you will get a loving, supportive person on the other line to support you in the next steps. We were able to create this past year Wabanaki Care Line, the first ever toll-free care line that is a crisis line for Wabanaki people. We want to make sure that no matter where you are in the state of Maine, that Wabanaki people can offer crisis services, can access crisis services, and have somebody on the other end of that phone, no matter what time of day, helping them navigate the crisis that they're dealing with. This care line was so critical in this entire development of a campus for Wabanaki Healing and Recovery, because we wanted to make sure we were able to reach people even when they were in the grips of crisis. And this is allowing us to do so. Our critical incident stress management system, our SISM system that we are developing and have been developing and in the process of training. We have chiefs, vice chiefs, and many other community members involved with creating this system. What this is an ability to respond to communities that are in crisis. We know well that our communities lose our people far too young, far too often. And when we lose people, oftentimes our community is struggling. We wanted to develop a system that when our community is struggling, we can wrap around culture, love, and supports. We knew that having a strong continuum of care recognized that we will have crisis. We will have hard times, but having a system to respond and to travel to that community and wrap around those supports was something that we were able to develop in this past year. And this system was really, really supported by Chief Sabattis, who said, we need a system like this here for Wabanaki people in Maine. She has utilized this system from her Maliseet relatives across the border in Canada. And when her community was in crisis just a few years ago, she utilized this system from across the border, and it was critical in the healing of her community. And so because of her leadership, we were able to create it here. And we are pretty excited that this is a part of our entire system of care when we're talking about recovery and crisis. So future vision, this is where I'll stop. We have a lot of dreams. When we think about all of the things that our folks need to feel supported, loved, and have the conditions to heal, there's a lot. There's a lot in that continuum, and we're working hard to make sure that's done. Enhance recovery and healing services. Detox is a must. Detox is needed in the state of Maine for everyone. We have a crisis in the state where we do not have enough detox beds. We want to develop one. We not only want to develop one for Indigenous people who need detox, but we recognize that many people need detox, and we want to be open to all. We're in the process of doing that development, planning for that development now. So again, this will come later, hopefully late fall of 2021, just this year. Equine therapy, outdoor and adventure connections are both important. We heard this from every treatment facility that we visited. Connecting people to the outdoors as well as animals has significant healing properties, and we're investigating opportunities for those. Skill and career development, we need to give people opportunities for their next step, whatever that might be for them. And we need to be ready for that, to support them in their dreams. And we're looking at opportunities for that now. Having women's recovery homes, we have a beautiful partnership in Millinocket, and we also know we need other Indigenous recovery homes for women. We are still struggling to meet the needs in our community, and this is an area of need, and we are working rapidly to begin to address this need. Our farming programs, connecting people to things that grow, is deeply healing. We know that, we've heard that, and we want to offer that in this program. Housing, not just recovery, we have issues regarding housing that puts our families at risk. We're looking at opportunities for expanding housing beyond recovery. And we're looking at diversifying our funding sources. One thing is that this work is expensive. It's costing money. And while we are really good at securing grants, we have to think beyond grants. We have to think, how do we create these services for as long as our people need them? For as long as they need them to heal, we need to offer them. So we're thinking creatively about opportunities there as well. I want to thank you, Chief Williwan, for the time today. I want to thank both Chief Francis and Chief Sabattis for your leadership from the very beginning. Wabanaki Public Health and Wellness is honored to be able to do this work, and we wouldn't be able to do this work without your leadership. So Williwan and Upchich. Thank you, Erica.
Thank you, Lisa, for your presentation. Thank you, everyone, for being a part of this presentation. Thank you, Chief Francis, for your words. Thank you, Chief Sabattis, for your vision. It's an incredibly exciting time. And with that, we close our presentation. And if you have any questions, my email as well as Lisa's email will be in the chat. And please reach out and ask any of your questions to either of us.